Hello, everyone. My name is Father Pete McCormick, and I serve as the Director of Campus Ministry. It's my honor to come and join you all this day, along with some wonderful colleagues. Provost Miranda has joined us, as has Dr. Fox. Both of these individuals will share with our community some very important updates as it relates to COVID-19. But maybe if I can offer just a few opening remarks. It has been so impressive what we have seen and what I have seen over the arc of the past several days as we have learned about the surge in COVID-19 cases on our campus and near our campus. The resolve that each of you have shown has been so impressive as we have learned information and learned differently how to battle this foe that has been with us since March. From people wearing masks while running, which has admittedly inspired me to do the same, to also each member of our student body being thoughtful about various members whose names or stories they may not know, to be attentive and thoughtful about the common good, not just our own singular needs. But before going too far into this, I want to take a moment to address a very important topic, and that is this notion that somehow a decision to send students home has already been made. That could not be farther from the truth. It is our great desire as a university community to have students, staff, and faculty here together, because Notre Dame is a better place when we are able to be in community with one another. So any decision that gets made over the arc of this weekend that could potentially derail our great desire to be together as a community is important to be thoughtful. And furthermore, we must consider each and every step. But let me frame it for you this way. Over the course of the next few days, Friday, Saturday, Sunday, this is a decision that will be made in terms of what you do that will not just impact this weekend, but it is a decision that will impact September, October, and November. As an informed community, I believe that we have the capacity to go about making decisions that allow us to remain together as a Notre Dame family here on this campus. So with that, it is now my honor to introduce Provost Miranda as she will address new trends that we have found over the arc of the past few days. Provost Miranda.
Thank you so much, Father Pete. It's such a pleasure to be with all of you today. As Father John has said many times, COVID-19 is a formidable foe. Over the course of the summer, we developed a detailed battle plan. But as is oftentimes said in the military, no battle plan survives its first contact with the enemy. So we hit COVID-19, we had a surge, we had to come up with a new battle plan. The incredible number of staff who have worked very hard, tirelessly over the past week or so to completely shift and adjust our plans so that we have a new battle plan. That work has been completely heroic. We're grateful for all of the feedback that you provided us that allowed us to adjust those plans, and we're better because of your feedback, so thank you for that. I've oftentimes talked about the fact that unlike March, the decision for us is not a 0-1 decision. It's not keep everyone here or send everyone home. There are lots of places in between. And one of the places in between is you take a 2-week pause on classes. And that's what we're doing right now. So one of the question as we look at the data every day is what impact is the 2-week pause on classes having, and how do we make it possible to transition from the 2-week pause to being back together in the classroom as a community. So the good news is that all of the data so far over the past few days has been good. While the number of cases has continued to rise, and that's concerning, the number of new cases each day has gone down. That's a good sign. Our positivity rate has gone down. The positivity rate, so the number of positive cases divided by the number of tests, that's gone down. So that's a sign of, are we doing enough testing? And also, what is the surge looking like on campus? And the other thing in the daily health check is the number of people who are reporting major symptoms or minor symptoms or having been in contact with someone who was diagnosed with COVID-19. those numbers are down as well. So those are a few days worth of numbers. They're not definitive, they're preliminary, but they're preliminary in the direction that we were hoping for. We have to continue to watch really carefully where those data are going, and we have to continue to be really careful about our behavior. There were a couple of larger parties that were the source of the initial seeding of the infection on campus. But now what's happened is, since the infection has been seeded, there are people who may be asymptomatic carriers in a variety of places. It's one of the reasons we started surveillance testing. But what that means is, when you're in your group of your 8 to 10 closest friends, I know what that's like. You know, you want to hang out with them. They're your closest friends. You trust them, and that's great. But you still have to wear your mask in that situation, because until we get a better handle on this and have a clearer sense through surveillance testing, through the diagnostic testing of where this virus is, and it is a formidable foe, until we get that better sense, we just have to hold really tight, as tightly as we possibly can, to those 4 public health protocols. Wear your mask, physically distance, wash your hands often, and complete your daily health check. So we check a lot of data, and one of the pieces of data that we check is the weather. So I just want to forewarn everyone that next week's going to be really hot, and it is hard to wear a mask when it's really hot. But I beg of you, continue to wear that mask, continue to physically distance, continue to wash your hands, and do your daily health check, because in your daily health check, getting that information on who's exhibiting symptoms and who thinks they've been exposed, that's what's helping us get on top of this surge that's going on right now. The last thing I want to say is, I'm new to Notre Dame, but I love it already. And I can tell you, I love it way better when the students are on campus. So everything that all of us can do to make sure that all of our students are still on campus, I'm for that. And I believe that of all the communities in the country that can make this happen, this is the community that can take the blow and get up and get us back into the classroom.
Provost Miranda, thank you so much for that important message and thoughtful insights in terms of where we are and where we have the potential to go. Our next member of this important panel is Dr. Mark Fox. Dr. Fox serves as the Deputy Health Officer of St. Joseph County Department of Health. Dr. Fox.
Thanks, Father Pete. I'm glad to have a chance to talk with you all today. I think it really signals the university's commitment to work with St. Joseph County. In fact, throughout the course of the pandemic, even dating back to last January, when coronavirus really was first being recognized, we worked closely with the university in preparing to respond to the advent of coronavirus on the Notre Dame campus. And throughout all those conversations, one of the foremost concerns has been obviously not only the safety of the Notre Dame community, but the impact of the university's presence and the return of students on the broader community of St. Joseph County. So I'm really pleased at the level of attention to detail that the university is committed in recognizing that impact. As the number of cases have increased this week, we've continued to work very closely with the university. And the university has ramped up its efforts, across all dimensions of this response in terms of testing, adding surveillance testing, the contact tracing, and we work closely in helping plan and coordinate the response between the university and the county and the state. All of that has been really critical. I think the unique opportunity here with the University of Notre Dame is, as a relatively self-contained community, populated by a group of people who really are committed to one another and committed to the mission of the university, there's an opportunity to vigorously pursue these mitigation strategies that, as a public health professional, I wish we could see replicated in every corner of the state and all across the country. I think there's the opportunity. We have very few tools in our toolkit. but all the things that Provost Miranda just mentioned, washing your hands, wearing your mask, observing physical distancing guidelines, staying home if you're unwell, getting tested as appropriate, and following the guidance of university health services and public health officials related to isolation and quarantine. Those are the tools that we have, but I'm convinced that this community can respond and pursue all of those strategies and ultimately be a model for not only other college campuses, but for cities and counties and states all across the country. The University of Notre Dame is certainly part of what makes St. Joseph County special. And I truly believe in the efforts that are being pursued and the opportunity to change the course of not only the spread of coronavirus on the campus, but actually to see the university preserve the possibility of in-person instruction. As Provost Miranda said, campuses are a lot better when people populate them. As a professor in the med school myself, it's much better to have students in the classroom. So as Father Pete said, this is a critical time, and with the hot weather coming next week, it's going to be all the more important that you follow the public health guidance and endure the discomfort of a mask to keep yourself and everyone else healthy. But the county health department is here with the university to help support in this effort to keep everyone on the campus and in the community safe. So thanks for the opportunity to be with you today.
Dr. Fox, thank you. So grateful for your words of wisdom and your partnership with the university community. It has been so very important. As we draw this segment to a close, first I'd like to thank Provost Miranda and Dr. Fox for their participation and their leadership here at the university. But I'd like to offer just a few words of reflection of my own in closing. The first is knowledge is power. What we hope in the recording of this session is that this information might be shared broadly. So please, if you have received this and appreciated it, please send it out, email, tweet it out. I really don't care. I just want to make sure that people get it. The second thing is perhaps a word of thought for us. Who are we going to be in September, October, and November? Really starts with today. That's the nature of the foe that we face. So what is the commitment that we are willing to make this day, tomorrow, the next day, out of a desire to remain as a community throughout the entirety of the fall? But also perhaps some thoughts about that. What we need most at this time are exactly what we have. Thoughtful men and women who are curious and capable of fostering communities in new ways. But also men and women who are thoughtful about reaching out to those who might be anxious, who have the ability to anticipate the needs of another and to sacrifice what might have been your preference because you recognize how important the common good is. We have a great opportunity here to learn from one another, to grow as a community, and to have amazing stories in the years to come about how we, the Notre Dame Fighting Irish, looked COVID in the eyes and said, "Go Irish, beat COVID."
Yeah.
Many blessings on every single one of you. Have a wonderful weekend.